As I've previously said, I'm Kate Thornton, the Senior Marketing Manager here. I'm going to be going through the topic, or we're going to be going through the topic of Freedom Day and what that looks like from a HR and health and safety perspective. Before we begin, there are a couple of things that I'd just like to run through, which is we have 650 people, as I've mentioned today, already registered. So if you face any difficulties, please drop your questions into the Q&A box and we'll try and answer them. You can see the example here, how we go about that as well. We are going to have a Q&A session at the end, so please feel free to drop any questions that you have for any of our presenters throughout the webinar today, and we'll do our best to endeavour to answer them at the end. The webinar will be recorded, or has been recorded, and there's a link on YouTube that we will send to you afterwards. So we'll send you the slides and the recordings, so you'll have them. So just like to go through a bit of the structure today. So in terms of what the webinar was going to be about, as I say, I'll do a quick overview of MorePay for those who aren't familiar. I'll introduce you our hosts, Michelle Hobson, Phil Barker and Audrey Robertson, and then we'll go through the main session and we'll come to the Q&A at the end. So just very quickly, for those of you who aren't customers of MorePay, I'd like to introduce us. In short, we provide payroll and HR software and managed services. We've been around for more than 50 years and we have around 10,000 happy customers across the UK. Now, how do we keep those customers happy? We promise to make payroll and HR easy, and we do that by focusing on 4 key deliverables. A simple onboarding process, easy to use software that has rich functionality and is loaded with great analytical tools such as our reporting suite. And we also have, flexible services delivered by a team of dedicated payroll and HR experts. So I'd like to introduce our panels today. So first of all, we've got Michelle Hobson. She's our HR Technology and Services Director. She joined MorePay in about 2017 and is responsible for running all the HR services activities in MorePay, which includes technology, HR, health and safety and employment law. Michelle has over 15 years of experience in both operational and strategic HR, and she's CIPD qualified. We've then got Phil Barker in the middle there. He's our resident health and safety expert. His job is to lead up our health and safety side of the business. He has over 20 years experience in occupational safety, health, food safety and compliance. That's one to get my teeth around. And last but by no means least, we've got Audrey Robertson. She's our HR Consultancy and Claims Manager. Her job within MorePay is to manage the HR policy team and advise our clients on matters of employment law. She's got over 15 years experience in employment law and HR consultancy services and is also a mental health first aider. So as you can see today, guys, you're in great hands with regards to covering this topic of how Freedom Day will affect businesses. So without further ado, I'd like to hand over to Michelle.
Thank you very much, Kate. So if we just go into the next slide, please. Obviously, the 19th of July is a date that's been imprinted on most of our brains since Boris Johnson first announced the roadmap out of lockdown back in around February time. And obviously we've received confirmation this week from the press conference that the 19th of July, dubbed Freedom Day, is going ahead. Now, I think when everything was set out at the beginning in February, there was a very clear idea of what was going to happen. And although we are now looking at what is being lifted and many of the restrictions are being lifted, they're probably, it's worthwhile saying, being lifted in circumstances that we didn't necessarily expect. So to put the context in it, we know that at the moment cases are rising due to the Delta variant. And whilst hospitalisations and deaths are sadly still rising, they're not rising at the rate that they have done before due to the success of the vaccine programme. But I think it's very important that we talk about what is going to happen on Freedom Day and what this means for employers in the context of that environment. So we are going to touch on the things that are being lifted, the restrictions that are being taken away. We're also going to overlay what the government are then advising. So where they have changed things that were legal before or potentially illegal, they're still issuing quite a lot of advice around it. And we're going to talk about all these different areas in HR and health and safety. We won't have the answers to everything because there are still quite a few unknowns about how this is going to go, but we've certainly got the context of which we are preparing our teams to advise the customers that we've got. But just to summarise what's happened in the latest announcement then, the main things that we've taken from this around what this means for employers is that the work from home, if you can, requirement has now been lifted. Now, this is one of the most longest standing rules that have been in place since March 2020. Some businesses decided to go back early and are already been operational for quite a few months in COVID secure environments. Other businesses like ourselves are still working from home. So that is part of the latest announcement. One of the biggest things for us to help our customers and you guys on this webinar through that this requirement's now been lifted. The legal requirement for face masks and social distancing will also cease on the 19th of July. So in black and white terms, that legal requirement has gone, but we're going to help talk through what we think is advisable, what the government are advising, and some of the potentially confusing messages that are out there. We'll try and put a spin on that. As I've said, some places have already been open for some months, but this lift in working from home, if you can now, will mean that some workplaces will be reopening for the first time in the best part of 18 months. So there are workplaces that are already open. They will become potentially much busier as people come back to the offices. Shared offices will potentially become much busier, and commutes to work, both in terms of on the road, rail, however people commute, will start to become a lot busier too. So there is still an expected wave in terms of this exit process. We've already started to see the impact of some of the restrictions that have been lifted in continuing to cause COVID-19 cases to rise, and that is expected to continue and continue to rise after the 19th of July. And this is the thing that we know is going to be concerning for many people, probably including ourselves, but we need to think about what this means for our employees and how we can help them. It also includes people who are already vaccinated, who may be clinically vulnerable, those who've just had one dose of the vaccine, those who've chosen not to have the vaccine, and even those who are just potentially generally very nervous about the whole situation. So all that context of the announcement and what has changed are the things that we're going to talk through and give you some advice and guidance on. But if we just move to the next slide, I think it is important to remind ourselves of what the government set out at the beginning about how the tests were for them to reopen society and, importantly on this call, reopen the workplace. So the 4 criteria which have been met are the vaccine. First one was the vaccine deployment. I think it's probably without doubt that we have had a very successful vaccine rollout programme in terms of the percentage of the population that have been vaccinated. And as it stands now, obviously this is changing all the time, but approximately 2/3 of adults are now fully vaccinated, and every adult will have been offered at least one vaccine by the end of next week, which is ahead of the deadline that the government set for the end of July. Vaccines are reducing hospitalisations and deaths at the moment. As I said, yes, there is an increase and there's an uptick in hospitalisations, and that is leading to an uptick in deaths. But the government are saying that this is not at the levels that we've seen previously and in previous waves. It's much more reduced levels. Hospitalisations in general do remain low, but as it says there, that there's a particular big reduction in hospital admissions for the double vaccinated people. The other test was around that risks are not fundamentally changed by a new variant of concern. So obviously we do have the Delta variant, which is causing the significant uptick in cases, but that has not fundamentally changed how the government have looked at the risk profile of where we are at the moment. And all of these tests together have been met and are therefore leading to us moving to the next stage on Monday and the reopening of the workplace. So I guess that's the context and the background of where we are at the moment, but we know that there are many questions that are rising for this, and a lot of businesses are coming to us to ask us to help them make some decisions where legalities have changed but guidance remains, and helping to work through that. So what I'm going to do now is I'm going to hand over to Audrey Robertson, who is going to talk about the impact of these from a HR consideration perspective.
Morning, everyone. Just a little caveat before I start. I guess that many of you have joined us this morning because you have a proportion of your workforce still working at home. Your workplace has been either shut or limited. I'm not making an assumption that everybody is doing loosely office work, but clearly a lot of people who have been working at home for the full 16-month period and are particularly affected by the lifting of the work from home requirement will be those for whom a desktop and a laptop is kind of most of what all they do all the time. So apologies if this doesn't quite apply to you, but I have tried to think in as broad terms as I can. So although the government's lifted the work from home if you can requirement from next week, they've been careful to add there's no reason for businesses to rush back. And there are a few reasons for this. Firstly, as Phil will talk about in a little while, the guidelines haven't fully been published. And also there's no particular benefit to rushing back, and there are probably some health disadvantages if people take next Monday as a mandated return day. So if your business has been closed or only certain groups have been in at the moment, there are some sound reasons yourselves to look at a delay or a phased return. It is really part of your general duty of care not to expect everyone to turn up on Monday morning after 16 months, even if you feel you've got some good plans in place. So what a phased or delayed return can do for you is give you perhaps the opportunity to test out any new physical arrangements you've made, like one-way systems or different arrangements for breaks or refreshments, the way you might have spread out workstations. And you can try this out with just a small group of people. And also some employees going from 16 months at home back to a daily commute might need a period perhaps to reacclimatise or maybe try out new travel routes and so on. If you already have a few people in your workplace, they might appreciate a gradual filling up as well, rather than a wholesale return, because even if they've been at work, they might have some concern about proximity to so many other people suddenly starting again. And the other thing, of course, is that as younger age groups are still being vaccinated, you'll end up with fewer unvaccinated people in your premises at any one time. So if you do go for a phased return, you'll have to consider the best way to do it. And I can't recommend anything because it's obviously about your individual business model. But you could, for example, return small groups of employees by their job function, or you could start by having people in for 1 or 2 days and build up. If job function doesn't really factor in your thinking, you could invite in a cohort of volunteers or try a rota, so everyone gets to sort of try out the workplace. There might be people who you have working remotely who are actually quite anxious to get back, and you could look at prioritising them on well-being grounds and develop a cohort of volunteers from that. But however you do it, do make sure that you communicate really clearly what the plans are. It's important that people are really confident, not just in the physical measures that you've put in place, but there's some clear leadership about how everybody's getting back. That'll help everyone be much more comfortable. And of course, one of the things you're going to have to deal with more as people return is managing absence. So at the moment, about 1 in 160 people in England have COVID. We're in the middle of a third wave. There's around 30,000 new cases a day. Wales and Scotland are taking a more cautious approach. There are lots of non-symptomatic cases that go undiscovered. And you might have even seen there's been some complaints recently about the oversensitivity of the NHS COVID app. So people are getting pinged despite only sort of circumstantial contact. So this means there are an awful lot of people self-isolating at the moment and a lot of people who are sick. As employers, you're going to be facing unexpected sickness absence at much higher rates than usual. Certainly for a lot of hospitality sites, this has become a regular feature of how they operate at the moment, but it might be something new for you to manage with more people coming in. So do kind of keep at the centre of this. It's really important to keep infected or possibly infected people out of the workplace, and that might require a bit of a switch of focus on how you manage absence normally. There's a lot of talk around at the moment about hybrid working, which is simply a managed blend of site working and remote working. even if this is something you've considered and rejected for your organisation or for people in the long run, a temporary hybrid working model could mean you can keep more people working from home if they self-isolate and are well, rather than having them off sick. So that's certainly something to think about. You can still claim SSP for employees who are self-isolating or off sick, obviously, for COVID reasons. So if they've been alerted by the app, you can claim that SSP. Just a note, especially over the summer period, self-isolators who are quarantining because they've been lucky enough to go on holiday, that's not eligible for SSP. So any of your employees going abroad on holiday are responsible for understanding the requirements at the time. I think we'd all agree that's no easy feat. They need to book enough leave to cover any quarantine. And of course, the same applies. You have a responsibility to help employees if you're sending people abroad to work as well. Again, if you delay people's return or you opt for a hybrid model, you can probably accommodate quite a lot of this in your plans. So before you start to make your plans, do have a look at your holiday rotas, and then you can create a phased return roadmap that will really work for you. And do check your absence policy is up to date. You'll also need, of course, to manage as non-COVID related absences and try and keep as many people in work safely as you can. And then, of course, the big question is, what do you do with people who may be very reluctant to return at all? Simply, that's a case of engagement. Talk to them, try and find out why. You might want to invite people in individually or in small groups to see the workplace and reassure them that there are sort of proper precautions. The anticipation is obviously often worse than the reality. You may want to talk to them about if there are concerns around public transport. Are there ways in which they could perhaps change their hours or travel differently? I'm going to talk on the next slide about sort of the culture of your workplace and changes that you might need to make. But I would say it's important to be aware of escalating a refusal to return into a standoff before you've had a conversation. It could be something that's simply resolved by a conversation. Might be they just need to wait till their vaccine has taken full effect. It could be something you can accommodate, like moving them into a less busy area or somewhere that's not customer facing. At the end of the day, obviously, the mandate and shielding have both been lifted. Eventually, you could be in a situation where someone who is AWOL and you'll need to manage them through your usual processes, but do try to avoid getting in that situation as far as within your control. It's worth you spending some time reflecting not just on the physical workspace, but also what kind of culture you've had and whether there might need to be some permanent changes to that. So changes will happen, and it might be better for management to take a lead on this rather than sort of waiting for issues and disputes to arise. So again, this is so different for everyone. I can only suggest a couple of ideas. In some places, for example, it's common for people to loiter around colleagues' workstations for informal discussions rather than using breakout areas, and that might make other people around them uncomfortable. You might have always had set break times with a bit of a crowd in a kitchen area. On a more informal note, some workplaces love a shared buffet, don't they, where everyone brings in food. Might be worth thinking about alternatives where you can still enjoy a social occasion in the office without perhaps all the sharing of utensils and so on, both in terms of infection control and also people's personal comfort. If you don't do this, it will sound strange, but in quite a few workplaces, people routinely hug and embrace each other. And that might feel okay for some individuals still, but while we're in this situation, it's probably better to talk about not doing this. You can make it clear that mask wearing is perfectly acceptable. Some workplaces are looking at systems like coloured lanyards where people have a code that says, for example, red, I'm not comfortable with people in my space, or green, actually I'm a bit more relaxed about this. and that might be something you want to consider. But the key really is just a culture where people respect each other's space, and choices on how they're choosing to protect themselves, and that's all led by you. So just into this sort of final section, you might be wondering about what you can do in terms of measures like insisting on masks or tests or vaccines, and I think Phil's probably best placed to give you some information about that. But a few general pointers. It's good to encourage regular testing, but do be aware that if you're going to ask people to report the test to you, get into a whole situation where you need to know how to manage that special personal data. It might be better just to ask people to show you the app or self-report and not store that information. You'd need to consider, if you're going to tell people to wear masks, how far you can go to enforce that. Even at the height of the earlier waves, people were never expected to provide evidence of mask wearing exemptions. So you need to think about how you manage that. And some of that's obviously going to be the sector that you're in. The decision's easier if it's obviously a healthcare or public facing areas, of course. From October 2021, the government's introducing a law to enforce COVID vaccination for those who work in care homes. And by that, I mean that includes people who go in from external contractors, people providing services like hairdressing in nursing homes and so on. So actually it's going to be catching many customers, many companies. So if this applies to your business, there are a couple of things to consider. And I think the first thing from an HR perspective I'd recommend is that you write at a really early stage to everyone who's affected by that and let them know their role is going to be captured by the legislation. And then if they've not had the vaccine, they've got a chance to do that ahead of time, or to understand how the formal exemptions might apply to them. At this stage, I wouldn't be talking about consequences for their employment, but just explaining to them about how the law is going to apply to their work. If people already work for you, it's obviously quite a serious step to insist on a vaccine. And of course, that's why there's had to be some special legislation around it. But it is still contentious. Some of you might have seen there have been riots in France overnight around a similar issue. Seeking evidence from new hires in the future is a bit more straightforward. If you do need to move into this model, you'll need to look really carefully at what evidence you're going to ask people for. We all know about the NHS app, but there are other apps. There are certificates and letters. There are people in different categories. For example, people who have been vaccinated abroad with different vaccines, or people in clinical trials. And you'll need to make sure you're familiar with all the acceptable paperwork and so on. You could run into some difficulties if you start refusing work or employment to people who do have something non-standard as well. If you're bringing people back to the workplace anytime soon, again, you might need to delay that a little bit for people to finish getting vaccinated as well. In general terms, we just recommend you use a carrot rather than a stick. If people need paid time off to go and get vaccinations, that's probably more in your long-term interests than making them do it in their own time. Consider all the aspects really carefully if you're going down this path. That's taking a view of what the real risks are of having unvaccinated people in there, possible discrimination issues around particularly age and disability. May also be resourcing issues if you're in a sector with a labour shortage. So there's an awful lot to think about before you make blanket rules there. And just on a final note, if you decide to make arrangements for unvaccinated workers to only carry out certain kinds of work or restrict them in any way, please do take some advice on that. You'll need to make sure you're not inadvertently discriminating against certain groups of people, such as younger workers, and that you're not breaching contract. So just a cautionary note there. And now I'd like to hand you over to Phil.
Thank you, Audrey. Yes, thank you, Kate. So we'll now look at some of the health and safety implications. What we're seeing, and within a lot of the government guidance and a lot of the speeches and a lot of the talks in Parliament, etc., is a move away from the coronavirus regulations to guidance. So, as Michelle and Audrey have mentioned, they're relaxing the actual specific coronavirus regulations. When you start reading into the detail within the statements and the announcements on the government website, what they're saying for employers is that the existing health and safety requirements to do risk assessments and manage workplaces to ensure workers and everybody else's health, safety and welfare apply now to COVID. So whilst a lot of the regulations that apply to individuals as people, as in going to the pub, as in going to the cinema, as in going to the nightclub, will be lifted, the actual duties for an employer to manage the safety and the risk associated to COVID will be covered by existing health and safety legislation. So that's the Health and Safety at Work Act, the management regs, control of substance hazardous to health, because COVID is a biological agent. So a lot of these legislations will take precedence over the COVID regulations. So whilst the COVID regulations don't apply, you still need to have a COVID risk assessment in place. The government, really helpfully, and this underlines Audrey's point at the start of her section around not rushing back to work, the government haven't yet updated the guidelines. I've just checked before we started this session, and they're still not updated since phase 3. So we don't know what the guidelines are that we need to follow from next Monday. We can guess that there might still be a requirement to have perspex screens in pubs. We can guess that there might be a requirement to still sanitize hands, face, space. We can get a lot of that is just guesswork. So that underlines that don't rush back next week. Let's wait and see what the government guidance is and what measures our risk assessments need to consider and put in place. Health and safety legislation does have an underlying requirement to follow best practice and guidance. Even corporate manslaughter requires that we follow best practice and guidance. So it would be prudent to wait and maybe give it a week or 2 weeks before we actually really consider about rushing all those home workers back into the office. Let's see what the government guidelines still say. Let's make sure our COVID risk assessments are in place. Let's ensure that we're still following all of that COVID secure guidance that's still in place. The other thing about risk assessments is business continuity. The government are predicting, or the medical scientists are predicting, that we could have up to 100,000 cases a day as we reach the peak of this next wave. Now, if you bring everybody back into the office and you've got no controls in place, you're risking all your staff catching COVID from a couple of people bringing it into the office. Now, they might be vaccinated, so they're not going to necessarily get the severe symptoms that require them to go to hospital, but they're then going to have to self-isolate because the test and trace and self-isolation is still going to be in place for the foreseeable future. They're then also maybe going to be ill enough that they can't work to full productivity. They may not even be able to work. So you're potentially putting at risk a vast amount of your staff being suddenly coming from a home working situation to an office stroke workplace situation, then suddenly having to self-isolate or not being capable of doing the job. So from a business continuity perspective, do we really want to just jump into that and let's stop everybody working from home, bring them back into the workplace? It needs to be thought out, needs to be considered. Do we look at bubbles? Do we go back to 30% 1 week and then 30% the next? So we're having a cycle where it's 1 week in the workplace, 2 weeks at home. And we discussed a lot of this on the hybrid webinar the other week, which you can get from the recordings on our website. Also, traveling to work. Some of the mayors are stipulating that masks will still have to be worn on transport in their areas. Other mayors are insisting that the government reviews this guidance and that transport companies have to insist on masks being worn on public transport. So again, there's going to be a lot of anxiety from people potentially using public transport. Although I did see a picture yesterday where the London Underground was totally empty at 9:30. So there is a reluctance from people to use public transport. So will your staff want to come to work on the buses? Will your staff want to come to work on the tube? Is commuting around the country on the train a thing of the past? So just consider how people are going to get to work as well. Do we need to change start times? So again, we can look at that. We can look at risk assessments, and we can look at that staggering start times to ease congestion and all of these things. But again, we don't know what the government guidelines are going to stipulate because they're not published yet. Next slide, please, Kate. So again, face masks. If anybody watched Boris the other week, he used an analogy of the trains where he was advising that people consider wearing face coverings when they're in in crowded spaces, but not necessarily when they're away from that. And the guidance that I'm reading that was published on Monday this week is sort of similar for employers. It's around encouraging the use of face masks in a large area, in largely populated spaces. The kind of things that I think about are when we're in lifts. If we have to go in a lift to get to the floor where we work, should we be strongly encouraging, potentially mandating that face coverings are still worn in those kind of areas? Do we still want colleagues, employees, workers to walk around the workplace wearing face coverings? It looks like the government's leaving that decision open to employers, but it does again stipulate that it's your risk assessment, and again you have to make sure that you're managing the risks from COVID within your workplace. So the other things that we're talking around within that area around working safely are minimizing the numbers of people, minimizing proximity, minimizing social contacts, no longer expecting people to work from home, but doesn't expect a rush in and expecting a gradual return. We need to obviously consider our risk assessments, our cleaning processes. Are we keeping desks clean? Are we keeping touch points clean? Are we keeping fridges clean? And back to what Audrey was saying around breaks, staggering people's breaks so we don't end up with the entire workforce in the canteen at the same time trying to make a cup of coffee. Looking at poorly ventilated areas, making sure that we've got the maximum ventilation we can. Fresh air is a key point to moving any contaminated air within a workplace and getting that out and diluting it so that the risk of transmission from any airborne viral contamination is minimized. One thing that's key is when we're doing all of this, we talk to the staff, we engage with the staff, we make sure that we address their concerns. That's not just a fluffy bunny nice thing to do, it's actually a legal requirement. We have a legal requirement to consult with employees and workers and staff on risk assessments. So talk to them, understand their concerns, get suggestions from these from the people who know the workplace, and let's really get a robust risk assessment in place. As I say, we don't know what the guidance is until it's published, and it doesn't look like that's going to come out until Monday. So it's sort of a chicken and egg thing. We can't do the risk assessments till the guidance are published, but we need to be thinking about the kind of things that we're going to have in place. The COVID pass is one thing that we can look at, and there is an encouragement from the government that is used in high-risk businesses, so that's potentially care sector. What's it going to do in the hospitality sector? Who knows? Obviously, table service is disappearing. So how are we going to protect workforces? If we have a busy day and a customer brings COVID in and it spreads around the workforce, going back to what was mentioned on business continuity earlier, if we suddenly lose 50, 60, 70% of our workforce, how are we going to carry on working? So do we want plastic screens on bars? These kind of things. The test and trace requirements are still going to be in place. There is still going to be a requirement for the QR code. So there is going to be a lot that on the face of it, we expected to disappear when Boris announced that we were going to go into Freedom Day, but there are still going to be a few of those kind of a few of those rules and regulations that are continuing over into the guidance. And as I mentioned, within health and safety legislation, we need to actually work with that guidance as if it's really still requirement, because we have to follow best practice and best guidance to undertake our risk assessments. There's still going to be requirements of self-isolation, and we're still going to have to discourage people from attending work when they're feeling unwell. So a lot to consider. And again, as I said quite a few times, not helped by the fact that the government haven't updated their working safely guidelines yet. But just when you're reading through the announcement that was published on Monday/Tuesday, there are a lot of those key issues that are going to stay in place, even down to recommending lateral flow testing twice a week, just to help and make sure that people are not coming into the workplace with the illness. But again, discouraging people attending when they're unwell. Also, just reading this morning, there's some scientific pressure on the government to extend self-isolation to flu and other respiratory diseases and illnesses to protect the NHS. And there is also some medical pressure around from the Royal College of Obstetricians and the Royal College of Midwives around pregnant workers being at greater risk and also less likely to have been vaccinated. So again, a lot of people, a lot of things to consider when we're looking at this. So if you want to move on to the next slide for us, Kate. I think we've probably covered that, but again, I'll just cover that. So social contact is the key to controlling it. Audrey mentioned about people hugging in the workplace and discouraging that. Again, the government guidelines are talking around not bringing too many people back into the work, discouraging large meetings in small meeting rooms, looking at minimizing the sharing of equipment, so hot desking. If we are hot desking, can we make sure that things are cleaned between usages? So ideally, you don't want somebody using a desk for 2 hours in the morning and somebody using it for 2 hours in the afternoon, but nobody's cleaned it in between times. Again, lots of things to look at around social contact. And then obviously a lot of this is down to employers. The key thing within the statement that the Prime Minister made was that they're looking now at moving from regulation to allowing informed decisions. Again, that applies to the individual and to the employer. And as I've touched on quite a few times, the Health and Safety at Work Act and the management regulations all require that we follow best practice. And as I mentioned, even down to corporate manslaughter, we need to follow best practice. So it's really, really key that we get a steer on these guidelines from the government, and as soon as they're published, we're reviewing them and we're reviewing all of our risk assessments that we've got in place to manage COVID-19 and make sure that we're following the best practice set out in the government guidelines. Next slide, please. Over to you, I think, Kate. Or do you want me to pick this up?
Fine, I'm quite happy to run through it. So one of the things that obviously to conclude, please pop your questions into the Q&A box. We have got a few questions coming through, which I'll start asking our fantastic presenters, and thank you guys for going through the guidance today. So this is just an example of how MorePay can offer support. So we have a back to work consultancy that obviously will help you with all your legislation. It's developed by both Audrey and Phil's teams in order to help employees safely return people back to work. It handles all sorts of questions you may have that we've just covered on this webinar, along with well-being and how to approach those types of things. So again, if that's something you're interested in, we will make sure that it goes over with the slides, and it's something again that if you are a customer of MorePay, that you talk to your account manager in more detail about. And so shall I move on to the Q&A? I think the first question we should go to for the presenters then. And I think maybe Audrey, this might be one for you. Are we allowed to ask whether employees have been vaccinated?
Yes, there's no reason why you shouldn't ask, but as always, do think about the consequences of what you're asking. So once you've got that information, what are you going to do with it? You might wade into deep waters by kind of throwing people off the premises. So yeah, there's nothing to stop you asking, but just have the question as a consequence of the plans you're making, not as a starting point.
Yeah, and I think on that one, obviously, a lot of it's going to depend on if you're servicing the care sector as well.
Yeah.
If you're servicing the care sector, as Audrey mentioned earlier in the conversation, the draft regulations were debated in Parliament on Tuesday evening. They're now going through the impact assessment, and they are likely to be enforced by October. And that is requiring that anybody who goes into a care home, as Audrey mentioned, is double vaccinated. So that can be anybody. Obviously, the ones you think about straight away are care workers. But if you think about painters and decorators, plumbers, gas engineers, electricians, all of these people that work in the care sector or work with care sectors will have that requirement. And we're looking now at the contractor vetting procedures that we provide to our care sector client base to put them in a position to be able to go and ask questions of their suppliers and their contractors to ensure that anybody visiting the care homes are double vaccinated. So there's going to be a legal, legitimate reason there for ensuring that those workers are double jabbed before they will go into work in that kind of sector.
Brilliant. Thanks, Phil. So another question is, if there's no social distancing in place and one person in the office got COVID, do the whole workforce then need to isolate?
That's going to be a depend. Right. The definition of, and I'm just going through this with a client at the moment. The definition of close contact is 15 minutes within a 2-hour period, and the algorithms in the app, and this is down to the whole argument around sensitivity of the app. The algorithms in the app sort of measure whether you've been 15 minutes in a 2-hour period in contact with the person that's tested positive. So that's where they're looking at the sensitivity in place. The moment the guidelines on test and trace and self-isolation are not changing until the 19th of August, at which point double jabbed and under 18s will have less of a requirement to self-isolate, and testing negative will have an implication on whether you need to self-isolate or not. So there's a lot of changes around that. When you phone as an employer, when you get a self-isolation, you're supposed to phone test and trace as an 02 something number, and you then give them the test reference number of the person who tested positive, and they go through and ask you a load of questions around who they may or may not have been in contact with and talk you through that who needs to self-isolate process. But to answer the question, I suppose, in theory, yes, everybody in the workplace may need to self-isolate. But this again comes back to why we need to be looking at risk assessments and still having some kind of control in place.
Brilliant. And then another one, I suppose, goes back to Audrey. So someone's asking, can clinically extremely vulnerable employees work from home?
The answer to that is simply you can organise your workforce as you see fit. If you're happy for people to work from home because they're clinically vulnerable, there's absolutely nothing to stop you doing that. Obviously, the shielding mandate is now long gone, and the government requirement to work from home, but there's nothing to stop you making any kind of arrangement with your own workforce as you see fit. So yes, if you've got someone who's clinically vulnerable, whether or not they are particularly concerned about coming back, that might be a good conversation to have with them.
And I'll just throw health and safety into the mix on that one as well, Audrey. It's the management regulations require us to take extra care and consider vulnerable groups within the risk assessment process. Traditionally, we think of disabled people, deaf people, young people, but obviously now that clinically vulnerable exposure to COVID throws that group into that mix as well. So when we're looking at risk assessment, having somebody who's clinically extremely vulnerable working from home might be a proportionate control for your risk assessment. So again, it all ties in.
Brilliant, thanks, Phil. And another thing that we talked about, and I think this is probably down to an employer's discretion, is question here is, if we choose to have masks to be worn as a policy, can we impose this on staff, and what would we do if they refuse to wear them?
Shall I go first on that one, Audrey, and then you can come up with the HR bit at the end?
Go on.
Right, so The Health and Safety at Work Act places and the management regulations places a requirement on employees to follow whatever controls you put in place to manage a health and safety risk. So it's the same here as whether people refuse to wear hearing defenders or refuse to wear safety gloves or safety boots. So if you determine that face coverings are required in your workplace to control COVID as a workplace risk, then under the health and safety regulations and that, you can legally expect them to follow that instruction. Now, I'm guessing there's a load of HR fallout that could come from that. So over to you, Audrey.
Yeah, it's a bit of a sad fact that mask wearing has become, for a minority of people, somewhat politicized. And as I mentioned earlier, even at the height of the previous waves, where people, you have to wear a mask in a shop, if people were clinically exempt, they didn't have to, and nobody was there was no evidence to provide to say why you were exempt or what the exemption was about. And while I haven't got an answer, I think that could be a bit of an issue. It's just something that's never arisen with wearing PPE in pre-pandemic times, ear defenders and so on. Nobody ever said that's an infringement of my freedom and I'm not going to do it. Or if they did, it's not a well-known phenomenon. So I think that I'd take, from an HR point of view, I'd take Phil's perspective on that as a starting point. And if you want to insist, you can. But yeah, hold on to your hats for some potential challenges around that and some difficult conversations. I'm talking about a minority of people. Most people will be quite happy to go along with that. And I think even some people who originally felt that they couldn't wear a mask have come to do it. So I don't want to overblow the problem, but it's just something to be aware of in the background.
I think, again, this comes down... Sorry, Michelle, yeah, go on.
I was just going to sort of add into what Audrey said there. I think the key point that she's saying, it is something that is unknown at the moment. It's unknown to everyone. In terms of challenging people and what kind of route you went down to either force them or otherwise is completely unknown in terms of consequences if you ended up in an employment tribunal. So it is right that it's probably going to be the minority that will push back. And I think what you just have to do is expect that that may happen, then take a step back and work through with either your HR team or if we are your HR provider with us, that individual circumstance and see if we can come to a resolution. There isn't going to be there's going to be guidance that we can give in general, but there's certainly not a one answer fits all, given this is so new.
Yeah, and I think the point I was going to make is if we do our risk assessments properly in a consultative way, then you should get the buy-in from the majority of the workforce, and it becomes a peer pressure thing. So if we do this, if we follow the process and we look to prevent that situation happening in the first place, so we talk to workers, colleagues, staff coming back into the workplace and ask them what they're comfortable with, what they're not comfortable with, and have an open discussion. And if you think that wearing face coverings, face masks is something that you're going to want to put in place, have that open discussion. And you'll find that people will either agree it's a sensible precaution and the few that disagree will just follow along because of peer pressure, or you'll identify that reluctance at an early stage and be able to talk it through before it becomes an issue. So I hope that helps.
Perfect. And one other thing that Phil is probably maybe aimed more at your area of expertise. Someone's asked us, if you work on a client site, do you have to work to their COVID regulations or your own policy?
Bit of both. It depends on the situation. I would work to whichever's the strictest. We've had clients come into this question over the last 18 months, realistically, where they felt that they're going on their customer sites and people are not following guidelines as they should. And we say, well, if you feel that your procedures are stronger, follow your procedures. Yeah, we've had that. We've had this already. It's not a new phenomenon, but it's going to be more of an issue, I think, as we move into the next phase, as people are relaxing. Some people will just throw away the rule book and just do everything. So you are going to come across situations where field workers, field engineers may not feel safe working on a customer site. So health and safety regulations and legislation has a duty between the responsible person of both parties to work together. So if there is an unease and an uncomfortableness, talk to the relevant people between both parties, or three parties may well be in some situations, and try and come to a resolution. And again, that's where our health and safety consultants can help and support that and work out what is best practice for that industry. Sometimes the individual might be expecting too much on that customer side because they're coming from a high risk sector into a low risk sector, and you get this. We get this outside of COVID as well. Again, we'll go back to hearing protection. Is one where that springs to mind, where we dealt with these situations where that the engineer and the customer have got different opinions on what should and shouldn't be enforced. So again, if you need to talk to us, and we'll come to some sort of we'll help you come to some sort of compromise mediation type situation that fits your requirements as the employer, because at the end of the day, that worker is your employee. They're not your customer's employee, so you have to be sure that they are safe working on that customer site.
Brilliant, thank you. And someone else asked with regards to absence from isolation. An employee is isolating for 10 days due to track and trace, but then they've tested positive themselves and need to isolate for a further 10 days. Is that classed, or could that be classed as one period of absence or two?
Well, I probably would classify that as one period of absence if it's continuous. So while they were isolating, they've caught it perhaps from someone else in their own household and now have to isolate for a further period. I think in general, I'd consider that to be a single period of absence. Michelle, I don't know if you've got any different thoughts about that.
No, I think you probably covered that. I think that's kind of the most sensible answer at the moment. It's so difficult with all of these, isn't it? But
it's all new.
Yes, that's the point before.
Yeah, they're off continuously. They're off continuously. It's because of COVID. That would be probably the approach I'd take in that situation.
Brilliant. And then someone else has asked with regards to the track and trace and and someone testing, do employees need to provide evidence of that to HR? So their test results from a PCR? Well,
I think, as I mentioned earlier, you might want the evidence, but be careful of the sort of data protection implications of planning to store it and so on. So you might ask to see the test. If you need to record that, just give it some thought about how long you keep that for, where you keep it, make sure it's safe and so on. But avoid setting up some elaborate reporting process that you're going to have to need to manage. But it's reasonable enough to ask someone to just see it on the app or whatever.
And I think it's probably worth calling out as well at that point on that one, Audrey, that if people are thinking about lateral flow testing as a control, similar thought process around data protection. Recording somebody's individual test results has to be for a legitimate reason, and the keeping of the records has to be for a suitable period. So again, just be careful and thoughtful around how you do any kind of recording tests. Anything else, Kate?
Yeah, we've got quite a few questions still coming in, but I'm conscious that we're getting to the top of the hour, so it might be that I'll ask one more, and then any that we've not managed to answer personally, we will come back to you later on this week in order to get those questions answered. One of the last questions then is, can you ask when you interview for a new job about the COVID and the guidance that the employer will be taking?
This is an individual, I'm guessing. This is an employee asking them. Yeah. Well, yeah, I think from a safety perspective, the employer should be consulting and notifying everybody once they've done the risk assessment. So that should be part of the communication with the existing workforce. So an employer should be able to provide that information to the candidate asking. And again, coming back to I think that I saw a report today on the BBC that there's more vacancies now than there were pre-COVID. So bearing in mind, candidates have probably got a choice of where they're going to want to work. As an employer, you might want to have that information available in case they ask.
I mean, I'd just add there that if I was applying for a job, I'd certainly ask, and if the employer was reluctant to share that information, I'd take something from that reluctance. I think it's a perfectly reasonable question to be asking.
Brilliant. And I say, and that concludes everything today. So thank you, Michelle, Phil and Audrey. As I say, there's a couple of questions that we've not answered. There's quite a lot coming on vaccines. Just to let everybody on the webinar know that we are actually running a separate session on Tuesday 11, which we will send a link out this afternoon with the recording to this webinar today with the slides, but also a link if you wanted to join that, because there'll be a lot more questions answered on that session on Tuesday. And then finally, have a look at our knowledge centre on our website. That's got, a raft of information with regards to anything to do with COVID, wellbeing, absence, health and safety, the consultancy services that we talked about today. But yeah, as I say, feel free to have a look. And thank you very much for joining today.